Hi, my name is Darby Medill, and for my business presentation project, I have chosen to focus on a women's health practice because I would really like to work in women's health after we complete nurse practitioner school. I think it would be really rewarding to look after women during their pregnancies and see them grow and flourish as they become mothers. My desired working environment would be in the Dallas-Fort Worth Metroplex with no specific city. The Dallas-Fort Worth Metroplex is an urban environment with around 7 million people as of 2023. 51% of that population is women. The median household income is around $80,000, and in this Dallas-Fort Worth Metroplex, 43% is Caucasian, 30% is Hispanic, and 16% are African American. I would like to have a private practice for women's health that works with hospitals in the area for delivery and NICU services if necessary. For the personnel, there will be 2 physicians, 1 nurse practitioner, 7 registered nurses, 4 receptionists or secretaries, and 2 ultrasound techs. The registered nurses will be responsible for vitals, admission history, height, weight, medication reconciliation, and possibly some medication administration. The advanced practice registered nurses will be responsible for medication reconciliation, getting the patient's chief complaints, and taking care of mid-level or non-acute patients. The physicians will be there to verify the nurse practitioner's work and see more acute and complicated patients. Our secretaries will be there to check in our patients and make sure they have all their paperwork done, and ultrasound techs will be used to do ultrasounds. My patient population will be women of childbearing age and their babies, and my mission is to work with women in the community to facilitate access to quality women's health and promote patient-centered care. The employment contract will begin with just 6 months to ensure compatibility between the nurse practitioner and physician, and this will include a month of orientation for the nurse practitioner, which is very important, especially if the nurse practitioner is a new graduate. Either party can end this contract at any time, and there is no non-compete clause in place. The contract components will include that major holidays are excluded, as well as weekends. A lunch hour is included in the patient schedule. On-call hours and days are firmly written in the contract, with 1 on-call weekend every month. The provider who provides that on-call service will have the Friday before on-call weekend off and the Monday after. The bonuses will be a percentage of money made for the clinic over $100,000, and the hours for the clinic will be 9 a.m. through 5 p.m. Monday through Friday. The dress code will be business casual, but they will also have the option to wear scrubs with their white coat and closed-toed shoes. Benefits include health, dental, and life insurance with short and long-term disability and 401k contributions. There will be 15 vacation days, paid time off with notice, and 7 sick days. Checkoffs with the physician for procedures will be specified in the contract to protect both the nurse practitioner and the physician's licenses. The financial basis of this practice is that it is a for-profit practice. It will accept private pay, insurance, and Medicare. There are no patient quotas for our providers. The starting salary for a nurse practitioner will be $105,000 a year, with the ability to earn up to $115,000 a year with bonuses and possible raises. Fees for patient visits and procedures will vary based on the complaint of the patient and if it is their first visit. We will charge a flat fee for the service provided, and there will be no price gouging based on the criticality of the patient or time of year, and expenses will include the staffing charges for the physician, nurse practitioner, nurses, secretaries, and ultrasound techs, as well as office charges such as rent, electricity, water, office equipment, printer paper, file folders. Technology is very important in the healthcare field, so we will need computers, a charting system, and email, and hopefully a nice website where patients can book their appointments online. Medical equipment is also a must with needles, flushes, syringes, collection cups, ultrasound machines, gowns, speculums, and it is important to note that this practice will need to have a relationship with an outside lab to perform the tests that they cannot perform in the clinic. The financial plan is listed as below, with average visits costs varying for new patients and returning patients. When our patient is new, we do not know exactly what they need yet, so we might have to change the price based on what procedures they might need. For a new patient with insurance, it'll cost about $250 to $350. For a patient with Medicare, it'll be around $200 to $300, and for a self-pay patient, it'll be $275 to $375, with prices varying based on what they get done. For returning patients, insurance will be $75 through $200. A patient with Medicare will be charged $60 to $175, and self-pay will be $120 to $225. There will be cost increases with additional procedures, and we do not know exactly what a patient needs until they come in, so we can't give them an exact price over the phone, but at least they have a range. To break even, the practice will need to make about $100,000 a month, and Appendix A details the costs behind this. The collaborative agreement is very important for both the nurse practitioners and the physicians, and the collaborative agreement is required by law in Texas. The nurse practitioner's scope of practice includes diagnosis, treatment, referrals, and collaboration, and this agreement must be renewed with updates as required yearly, so that we can ensure that our nurse practitioners are providing evidence-based, safe care up to the patient care standards. This agreement must specify what a nurse practitioner can do in the event of a birth without the doctor present. Though this doesn't happen often, it does happen, and we need to have this specified to protect our nurse practitioners and our doctors. There must be monthly meetings and performance reviews, and for the first 4 months of the contract, there should be weekly performance reviews so that the new nurse practitioner can figure out what's working well for the practice and what maybe he or she could do better. The procedures done by the nurse practitioner must be signed off on by the physician to protect the nurse practitioner and the physician's licenses. And the nurse practitioner must practice based on the Texas Board of Nursing regulations for advanced practice registered nurse practice. Evaluations are exceptionally important for our nurse practitioners, and the nurse practitioner's work will be evaluated based on patient surveys and the outcomes of the nurse practitioner's patients. The physicians and the other nurses must evaluate the nurse practitioner's performance in patient care in the workplace to ensure that this is a safe work environment with no toxicity. The nurse practitioner must be asked if they are seeing enough patients in a timely and productive manner. Though this clinic does not have patient quotas, it is important for the nurse to be respectful of her time and her patient's time and make sure that she is spending enough time with each patient while not going into the next patient's time. The nurse practitioner must have some self-evaluation. Does the nurse practitioner feel like they are providing safe, evidence-based care to their patients? And if not, what can we change at this point in time to make sure that the nurse practitioner feels like they are? These are my references, and this is my Appendix A, which shows the math behind the break-even costs. The overhead costs are costs that are not directly related to the production of goods and services, such as the rent, utilities, electricity, and water. It basically looks at everything that is not a salary. I cannot wait to graduate from nurse practitioner school and start taking care of these mothers and their babies and help them to feel empowered during their pregnancy stage and see them transition into wonderful mothers. Thank you.